وصينا بالمدان يا الله.
بسم الله الرحمن الرحيم. Alhamdulillahi Rabbil Alameen. Assalamu alaikum wa rahmatullahi wa barakatuhu. Thank you to everyone for joining us this evening on, I'm sure what will be an interesting discussion, interesting chat, because we are currently, continuing to be, to find ourselves in this particularly difficult situation with regards to the vaccine for coronavirus and this COVID-19. So we're trying to, our intention this evening is very much to provide information. We'll hopefully be able to provide some answers with our panel of experts that we have that will be joining us today. But ultimately, the decision will be yours. Ultimately, the decision is with people, and whether they wish to take the vaccine or not, it will be up to them. Our role and I think our very specific intention this evening is just to try to provide some information. There are lots of different people up and down the country, Muslim, non-Muslim, whatever they may be, who are finding these some of the challenges particularly difficult. There are people, and I think the other thing I really wanted to mention with regards to the situation, and with regards to in particular the conversation that we are due to have tonight, is that we are trying to do our very best to provide as much information as possible. There may well be a situation where our panel of experts in their own fields and their own, expert knowledge in their own areas may not have a particular answer to questions. So, we will go away and try to find out that information as if we can. The other thing I wanted to really point out, though, that there's a huge spectrum of emotions with regards to this, whether it's the lockdown situation that people are having, the financial, the mental health issues that people are facing, or the actual vaccine, which is what we are hoping to focus on this evening. There's a wide range of opinions and views. There are some that are very, very anti the vaccine in this particular case, and then there are some people that just like whatever, everyone should be taking it. Our view tonight is to hopefully speak to those people who are possibly in the middle, possibly unsure, they're uncertain, they're not too sure, they've heard some information, they're not sure how to verify the information, and they hope to be able to have conversations with people who are slightly more knowledgeable than them in this particular area and in this particular field, and then try to get that information through those means. We've had a number of people who have emailed us and asked us questions via the Ask the Imam function that Karima have on their website. So we will be going through those questions. What we also do encourage, though, is for people to ask and have their own conversations through the chat function as well, which you will be able to see on the side on the YouTube channels. The one thing that we do ask, though, is that people are, and we know it's a very emotive subject. We know that there are passions on both sides, or on both sides of the arguments and all sides of the arguments, and not just two. I think there's many more. Please do try to keep the discussions focused. Please do try to keep, and if you have any questions, please do pop them on there, and we will try to get to those as best as we can, inshallah. So without further ado, I'm going to introduce our panel. We've got a number of people who are with us this evening, and so we'll be trying to take it around at different opportunities and different times throughout the evening. So we have, and I'm sure some of you will recognise some people on the panel already. We have Brother Iblal. Do you want to just introduce yourself? Actually, it might be easier for you to give an introduction of your knowledge and experience in this particular field.
Yeah, sure. Assalamu alaikum, everyone. My name is Iblal. I'm a pharmacist. I've worked in community and recently hospital. I've been working in clinical trials for a bit, and now I'm in informatics and do quite a bit in data. I've been in and around public health as well.
Jazakallah khair. Dr. Sufyan, I'm sure many people will recognise also.
Assalamu alaikum. My name is Sufyan. I'm a GP locally in Buckinghamshire, having trained in Wickham and Stoke Mandeville hospitals locally as well. I'm actually currently involved with vaccinating at Adams Park in Wickham. Yeah, that's me.
Jazakallah khair. We have Dr. Yassar as well.
Assalamu alaikum. I'm an intensive care doctor. I've been working in ITU in sort of inner city Birmingham for the past 6 years, but I guess for this Zoom session for the past year in the peaks of the pandemic.
And we'll be speaking to Dr. Yassar shortly, really just to try and get a bit of an idea of what it's like, literally quote on the front line. We also welcome Sheikh Dr. Rafaqat. Assalamu alaikum. How are you?
Wa alaikum salam wa rahmatullah. Can you hear me okay? Because
We can
I'm
hear
using
you.
my smartphone at the moment, inshallah.
We can hear you very well.
So do you want me to give me a bit of a lowdown about
please,
my background?
if you could.
So I'm a GP in Bradford, and I've been teaching the fiqh of medicine now for probably over 15 to 20 years in quite a lot of depth. So I work very closely with ulama, with muftis and so forth on fatawa and things like that. So this is an interesting area for me. It's an area that I've sort of dealt with quite considerably, or especially more so over the last sort of 2 years, inshallah.
Jazakallah khair. I'm really interested to hear sort of your views, especially Dr. Rafaqat as well, in terms of this is obviously, as Muslims, this is a very it's a very emotive subject for a lot of Muslims, and then again, a lot of people are not understanding, including myself, admittedly not understanding some of the the fiqh side of things. What is our what should our response as Muslims be? And again, there are loads of other conversations, and inshallah, as mentioned, if people have any questions they would like to be directed at any one of our panel, please do put them in the comments, and we will try to get to those as they pop up and or as we can. The course of the evening, really the agenda, inshallah, is that we have in terms of the number of questions that we had as well, thank you so much for those, but they come in themes, so we'll be trying to discuss those in the themes as well, and that will just save us the backwards and forwards toing and froing, and inshallah allow us to delve slightly deep into some of those conversations, and possibly to look at some of the nuances of the arguments and the discussions as well. But before we get onto that, really, I wanted to try to get a bit of an understanding of what the current situation is, and what the current situation is across the country, really. So it's going to be difficult for us to get doctors on from across the country, but that's why we've invited Dr. Yassar from, who's, as he mentioned, currently working in intensive care units in Birmingham. Are you able to give us sort of a bit of an idea of what it's like for yourself on an average day, and the types of people that you're interacting with through your work at the intensive care unit?
Yeah, sure. So on the intensive care unit for the past, in sort of March, April last year, going into June, in the first wave, there was a huge changes in ITU in lots of areas, from patient demographics changing, the disease range of diseases changing. Obviously, COVID was the biggest thing, and it's essentially been like that for the past year. There was a bit of a lull over summer, but it's picked up again, and I think we've actually exceeded our COVID-related ITU admissions from last year. I mean, on a day-to-day level in intensive care, it's very busy. It's essentially unrecognizable to previous years. I've worked in ITU for quite a few years, and it's completely changed. If you saw a picture of it from 5 years ago, it looks completely different. So I can talk a bit about changes, if that's what you want.
I mean, ideally, if you could just talk about how it may differ year on year. So this time last year, although the pandemic was around, it really wasn't that big in inner city Birmingham, for example. So, and then again, I think one of the questions that I would very much ask, and again, I'd hope that people are cognizant that this is real now, but there are still some people who are having that conversation about, is this actually real? Are lockdowns necessary? Is this a situation that's just been trumped up and made up, and it's a plandemic and scandemic and those kind of things? So
so it's definitely
a flu.
Yeah, no, it's definitely not made up at all. So yeah, in previous years at this time of the year, we would have quite a few flu-related admissions. But again, staff rota patterns wouldn't need to change. We could handle the situation with our current level of staffing and resources. Now, I would liken intensive care to a war zone. So, we have lots of new recruits drafted in, extra pairs of hands, because physically there's not enough people to man the ITU, which is completely different to previous years in a normal sort of season, as it were. So yeah, the main areas of change has been patient numbers, huge increase, and 98% sort of COVID related. The other thing is staff numbers as well. So normally you have one ITU nurse for one patient, whereas now the ratio is one nurse to about 3 or 4 patients. In different parts of the country, it is different. So we find in sort of London, Birmingham, inner city areas, the nurse ratio is more difficult because the COVID-related admissions are much higher. And the other big change, I would say, is equipment. We're running low on all sorts of equipment, including ventilators, dialysis machines we're running low on, and actual drugs as well that we keep people sedated on. We're having to use sort of slightly older drugs, as it were, to keep people sedated, because the pharmacy has literally run out of drugs to keep people sedated. So, and the other thing, of course, is bed spaces. We're having to sort of use theatres. So all elective theatre surgery has stopped and has been stopped for quite a while, which is kind of unprecedented if you think about it. There's lots of urgent surgeries that are needing to be done, but that stopped. The theatre spaces are being used for COVID intensive care patients. And I would say the other big change is everyone is in PPE gear now. So it looks physically different. From a patient's point of view, I think probably the biggest difference, or from the patient's family point of view, is they can't visit. And that makes it very difficult for the family and also for us as well to communicate with them. So yeah, I could talk about any of these points, but hopefully that's given you a rough picture about what's changed.
It definitely gives us an idea. Again, one of the things I remember very early on in the pandemic was looking over to the information that was coming out from Italy, which was the epicenter in Europe in particular. But language definitely it's like a war zone. And that seems to unfortunately have continued, even though we're a year plus into this, and we're trying to be. Well, I don't know, how well the government have been prepared, but definitely that kind of language. Just in terms of our communities as well. So that in terms of, obviously Birmingham is a very multicultural community. What are the numbers of the community looking like in terms of those people that you're seeing from?
Yeah, so I work in the inner city Birmingham, so it's very ethnically diverse, a large Black and Asian minority ethnic community, including a large number of South Asians from Pakistani and Bangladeshi backgrounds, as well as Somali and Yemeni and Arab. I would say, we've roughly, population-wise, the demographic is about 60-70% BAME, but the actual ITU admissions, I would say, disproportionately, the BME community is disproportionately represented. So out of, let's say, 50 ITU patients that we've currently got on intensive care ventilated in an induced coma, it's approximately, I would say, near 90% South Asian Muslim, essentially. So there's definitely, anecdotally anyway, a disproportionate representation of our community, as it were.
SubhanAllah.
And the age ranges are different as well. As in, we're finding very, very young patients that I would never expect to see in ITU. Just earlier this week, we had to intubate someone who's 29 years old, who's otherwise fit and well, from a South Asian background, with severe, he couldn't breathe essentially, so we had to intubate him. But the age ranges that we're seeing now of people being affected, we've never seen people like this. You know, I would never imagine someone like that to get ill, but they are getting ill. You know, we're seeing routinely people in their 40s. I mean, that's routine. People in their 30s as well. But, you know, like I said, we've had people sub 30 now as well.
And is this likely because of the new variant?
Quite possibly, yeah. I mean, I'm not a virologist, but I understand the infectious rate of the new variant is higher than the previous variant. But for whatever reason, you know, whether it's genetics, whether it's lifestyle factors, whether it's socioeconomic reasons or multi-generational households, whatever the reasons are, you know, it's affecting our community a lot, and you know, when our communities sort of people pass away, it's extremely difficult to speak to the family, because they've been, you know, for 3 weeks at home just getting telephone updates. Whereas previously in ITU you could come and visit the unwell relative, you can't do that now. So there's a bit of a disconnect in terms of people believing how unwell their family relatives are, and I think that's been a key challenge in the pandemic.
I think there's a comment there. So I know a doctor in ICU in Birmingham has also mentioned Asians have a really poor recovery rate in comparison to non-Asians. This is an anecdotal observation from Brother Ahmed, but thank you very much for that. Dr. Rafaqat, I wondered if I could, I don't know again how active you are, I suppose, on the front line in that sense, but I'm sure you have a sense of the community in Bradford and the kind of challenges that they're facing in the hospitals in and around Bradford. Is that a similar, I'd imagine it's a similar story there?
Bismillah ar-Rahman ar-Rahim, alhamdulillah wa kafa wa salatu ala ibadihi allazina istafa. Yeah, so I suppose there's two ways of looking at this. There's the anecdotal sort of way, and then there's the actual figures and what they are suggesting. So clearly there's an increase in death rates in Bradford, and you know, anecdotally you can see that even from going to the local graveyard, and you'll see the amount of, you know, people who are being buried there is, you know, quite considerable relative to this time of the year last year. So there is clearly some kind of significance there, and I think people are appreciating. They realize that there's, you know, you can deny on the basis of controversy and various other things, but that's something that is clearly there in front of you. You can't deny that there are clearly more deaths there. And we also recognize that a lot of those deaths that are happening, which is usually the typical sort of setup, is the elderly population and the vulnerable population, which is the norm. But generally speaking, it's the numbers relative to, you know, to the cause. So we also look at it from the sort of figures, and the figures are telling us that the COVID-related deaths, and I think we need to be very careful about this, because when we talk about COVID-related deaths, what that really means, me as a GP, I'll sort of, who has completed a number of death certificates in relation to this, is deaths where there has been a diagnosis of COVID virus, and they have died from conditions which you would associate with somebody who's had a viral illness, but yet the impact of the viral illness has been such that they've either ended up in hospital in intensive care and gone to ventilators, or they may have died at home. So either way, there is quite a close association to the actual condition for what they've died, as well as the actual, you know, the fact that they've been diagnosed as having COVID before they died. Now, in terms of the people's perception, it can be really varied. People recognize there's been a number of deaths, and I think it's becoming more of a realistic thing for some of those people who had a sense of hesitancy in accepting that. I think people are really coming around this idea that, you know, this is real, because you could say that there will be virtually every member or every family grouping will have somebody who they know, either as family members or even relatives, who have actually died from a COVID-related sort of condition. So from that perspective, I think it's very real. The Bradford people really feel it. They know the situation, and there is a greater sense of caution there. Now, whether people are complying with you know, the sort of the guidelines that are out there, the recommendations, that sort of is questionable. I think, and that's not just solely sort of Muslim community thing. I think that sort of is something that's a pattern in all kind of communities. So I don't think the Muslim community is any different from any other community in that sense. Some people are complying, others are not complying as much. So that's a general thing. Now, in terms of the statistics, I can't sort of give you the statistics by hand, but I mean, our discussion here is in essence more about COVID vaccines as well, isn't it? So from that perspective, I'm quite surprised actually that our COVID vaccine uptake's excellent. You know, we're having, so we are part of what we call a PCN, a primary care network, and there's a number of GP practices, and we're right in the heart of the Muslim community of Bradford, which is like the city of Bradford, and people are turning up. You know, we got a very high rate of people actually turning up, considering that we've had really bad weather. So we've had snow and and things like that, and even then we're getting a real good uptake. Now I've been doing some of these sessions up and down the country, so London, Walsall, and many other places. And what people are telling me, I don't know whether those are figures that they're telling, but generally speaking, we get a bit of an understanding that that's not so much the case in some of the other areas. You'd expect Bradford probably not to be too different from there, but maybe there's more work happening in Bradford in terms of communicating with people. It just goes to demonstrate that, if you get the right kind of messages and you got the right people delivering those messages, and you're getting into the heart of the community, the root of the community, and you've got imams within the community who are clearly openly explaining that I have had a vaccine and I'm fine. I think that really makes a difference. So maybe there is a scope for a lot more work to engage with communities to deliver on that, considering that Bradford's no different from any other community. Controversies are just as bad as they are here than they are anywhere else in the country. So it's working quite well in Bradford as far as I know.
I think that was. I mean, we've been having that discussion. We've been having the discussion on and off for a number of weeks now. Whether we should have, do we need to this session? Do we need to have this kind of session? And we've watched a couple of your discussions and panels that you've had. But actually, we're hoping that with the community in High Wycombe, that they recognise and they understand that through the work that we're doing, hopefully there's a bit more trust in the process. But just coming on to the trust thing now, so if I can just move the conversation on a little bit, and then we had a number of questions that were put in. Now, I think maybe Dr. Rafaqat, again, if I could just ask for yourself your sort of thoughts on this, but I would definitely like to bring in Brother Iblal as well as has experience in pharmacy and pharmacology. So history has shown us and proven to us in the sinister agendas and agreements between Western governments and Big Pharma, which is the pharmacy industry. Why should we, as Muslims, blindly believe these people who do not have our best interest at heart? And again, I think this comes to the core of the issue around trust. Should we trust governments? Should we trust Big Pharma? And are we in a situation where we can take their word for what it is with regards to the vaccine?
Okay, so I think the important thing is addressing this, clear concern, which is, at the end, when we talk about people having vaccination hesitancy, rightfully there should be some element of vaccination hesitancy to some degree, but we also need to appreciate the reality and focus on two components mainly. The first component is that, are we trusting pharmaceutical companies? And the answer to that is, to some degree we are, and we do this on a regular basis. This is nothing new. We take regular drugs, we take medication for our heart disease, for our blood pressure, for our diabetes, and it's exactly the same pharmaceutical companies. We're taking drugs there and we're taking them regularly. All the only difference is, this is another perception that people seem to have, that they will accept gelatin in capsules, medication, but when you have gelatin in vaccines, there's some kind of conspiracy going on. So we need to be a bit realistic, and this is one of the things about clear reasoning and not really being pressed by emotive drivers that sort of motivate us to start thinking a bit differently. So our reasoning has to be very clear. It should not conflict with our general understanding and behavior. So if we have already accepted the drugs that are produced by pharmaceutical companies, then in this case, why are we not accepting vaccines, which is more of an issue. That's one point. The other thing is, and this is something that makes me very secure in this, and sort of relates a sense of trust in the system and not necessarily the pharmaceutical companies, and that is the issue of public transparency. So the level of scrutiny that vaccinations are having today, especially COVID vaccines, is unprecedented compared to any kind of drug or any kind of vaccine historically. It really is. The number of people who are actually writing academic articles on this issue, the number of people who are actually focused on the end outcomes and the epidemiology in terms of the impact and the effect of vaccines are so heavily recorded and measured and scrutinized today with COVID vaccines. And we've never had that level of scrutiny with any kind of vaccine or any kind of medication historically. Now, there is also public recourse. So in other words, we live in a system or a society where we have autonomy. We can decide to take vaccines or we can refuse vaccines. So on that basis, what you'll find is, because of that, and because of the level of transparency that exists in our system, every kind of detail will be out there and it will be brought to public domain. So the public can actually interpret that in many different ways. And one of the things that our deen teaches us, that you must فَاسْأَلُوا أَهْلَ الذِّكْرِ إِن كُنتُمْ لَا تَعْلَمُونَ. Do not analyze and interpret information that is beyond your understanding, but leave it to the experts. So we're very lucky, alhamdulillah, we have organizations like BBSI, the British Board of Scholars and Imams. We have organizations like BIMA, the British Islamic Medical Association. I work very closely with both of them. I've sat on their panel and we've written quite a bit of work, and there's a new piece of work that's coming out in terms of Ramadan and vaccines that will be coming out soon, inshallah. But generally speaking, I have a lot of trust in those individuals. These are people who come from many different backgrounds, many different professional fields and backgrounds. We have epidemiologists on the groups. We have scientists. We have ulama. It's not just myself. There's a few other ulama who have an interest in this area. And we scrutinize the system quite intensively. You know, we're not here to on a passive background. And these are voluntary pieces of work. We're not benefiting from this financially, nor are we benefiting this from some kind of some kind of position in society. So we are in essence under the scrutiny of our communities. So this is a very, very important thing to take note of, that when you take your information from anybody, then make sure that you're taking it from somebody who is, Allah subhanahu wa ta'ala says, "Kunu ma'a sadiqin," be with the truthful people. Take it from those individuals who have a sense of recognition in their society for making claims that hold weight. Now, unfortunately, a lot of viral videos are going around on WhatsApp and various other social mediums of individuals who have no expertise in these areas. They have, number one, they're not ulama. Number one, even if they were ulama, they don't have any expertise, understanding in fiqh medicine related to vaccines. And I will say that as somebody who's come from that sort of field, and I deal with these individuals regularly. Okay. And the other thing is that you're dealing with individuals who have no understanding of epidemiology, which is a very important aspect of understanding the seriousness of COVID, as well as the vaccines, as well as the actual figures that are presenting and how those figures are being interpreted. You need a good scientific lens of people who have that experience, and they do this on a regular basis to be able to give you and feed that information to you. Now, I've got a science background. Okay, I've got a public health background, work with public health. I've got a medical background, and I've also got Islamic traditional knowledge background. And I will tell you, I've got gaps in my knowledge when I interpret those figures. So I have to rely on those people who have a much more intense and experience and knowledge and understanding of these particular figures to interpret them for us, so that we can work with them, even in terms of what we produce when we come to the fiqh sort of perspective. So you have to have some kind of trust in somebody. So my point that I'm sort of putting to you is, those of you who are still hesitant, or you think there's some kind of controversy going on and we can't trust pharmaceutical companies, is, so who are you trusting then? You must be trusting somebody. Are you trusting your neighbor? Are you trusting that individual who's giving you emotive messages on WhatsApp? Who are you trusting when you are making your decisions, which have an outcome? Your decisions are very, very important. I mean, this is something you can't sit on the fence with. You have to make a decision on this, and your decision is very important, especially if you are referring to elderly, vulnerable members of your household. Because if you are refusing vaccines on their behalf and they are not being vaccinated, and if anything happens to them, then you're accountable, because you have related information to them through an emotive means and not actually approach people of knowledge. And this is very, very problematic. And I think that's a responsibility all of us have in a community setting. If the outcome is a minor outcome and it's just about I didn't take my vitamin D, then fair enough. But you're talking about something very serious, because potentially people could die if they don't have this vaccine. And that's the reality of the situation. So you hold a sense of responsibility to your family members, especially the elderly members of your home. So in essence, that's my clear message about the issue of trust. Even though you don't trust the pharmaceutical companies, recognize the level of scrutiny that exists out there is producing a safe haven for us to accept what the scientists and the ulama and these people who are working with the scientists are telling us.
Can I just say on that point, Dr. Rafaqat, just to try and to bring the point home, there are a number of people who admittedly don't understand the science. They don't understand the data and the stats that are around the science and the information there is there, but they do have a deep distrust, or they may even have personal experience where someone may have been given a vaccine or a medicine, and that's actually had a detrimental effect on themselves either or their loved ones. And then I think it kind of brings on to the point about because we have to, like you said, does it just become just an emotive subject? So it's an emotive subject, so I'm now just going to back off, and I'm just going to wait to see what happens. And is that an acceptable approach to have?
No, we recognize the reality of situations. So when I say emotive, what I'm referring to is I'm talking about individuals who are basically producing these, videos and passing them around. They're not telling you the science behind it. They're not explaining any kind of the knowledge behind this, but they're just giving emotion messages. Now, there is something about being real about this in terms of if there are certain adverse outcomes. Let's say, for example, we had our first sort of set of vaccines that went out, and we saw from a population, how many 6 million people have been vaccinated just in the UK. Many million have been vaccinated all over the world.
So
and they are
9 million as of today, I think.
Yeah, so come on, let's be real about this. We've had so many people vaccinated, right? We would, if there was some serious harm in this vaccine, or there was a significant harm in this, we would know. That's very clear. We would definitely know by now. The level of scrutiny that's out there, we would know about them. People are cherry picking different little things. So we've had a case from Germany where people have sort of picked up on, and now this has been really blown up and sensationalized everywhere, and people just don't even understand what the situation is there. But the reality in Germany is that there's a vaccine out there, and frail elderly people who would be quite severely harmed just on the basis of having a high temperature and having a viral illness. Those kind of individuals who are vulnerable to this, unfortunately, were at the brunt of having a vaccine. There's no doubt, we don't know what there's no clear evidence that it's the vaccine that's caused it, but there's a very good chance it's because of the fever and the symptomatology that comes with vaccines may have caused or led to a greater sense of vulnerability in these patients, and they may have died as an association of that. Now, that's a possibility, and we can't deny that. We accept that. So the response to that is be careful. So this is a response to the clinicians that are out there vaccinating people. Be careful, have a look at their records, make sure that these are not really vulnerable people who, if they did get a temperature, that they would be actually quite susceptible. Now, taking that into consideration, let's look at the figures in the UK. Now, how many deaths have we had in the UK, from vaccines? None, as far as I'm aware of. No recorded deaths. Okay, we've had people with side effects. Are the most side effects like fever for a few days, and swelling, pain on the arm that they've been vaccinated, and that's about it. We've not had any serious precautions. Right, that's one thing. Now, from the Islamic perspective, we look at the concept of what we call Mukhtara Ahwan al-Sharrain. So basically, you choose the lesser of the evil. So you look at the harm benefits. So you do a harm benefit assessment of it. So even if there was, and this is the reality of the situation, even if there were deaths related directly with the vaccine, okay, we need to be cautious and protective of this issue, and then we would need to balance the benefits and the harms. But alhamdulillah, we've not even have to make those kind of decisions, because clearly we're not getting any kind of significant harm from vaccines. And we've had, you know, over 6 million people have been vaccinated in the UK, yeah. So you can already see that the level of trust is increasing with vaccines. And I'm going to say this because sometimes people give the negative message. I'm giving you a very positive message. There's human behavior is like an exponential curve. So what happens is initially there's only a few people that have it done, and then people are very hesitant about it. Then everybody gets it. So, you know, more people get it done. More people tell you the stories. I'm fine. Alhamdulillah, I've had my vaccine. My mother's had a vaccine, so I, you know, put my mother to the test to some degree. She's had a vaccine. Alhamdulillah, she's fine. You know, I'm fine. Alhamdulillah. So from that perspective, the more stories you have out there, you will see the curve just exponentially. So, you know, all these people who are pushing this agenda about the harms of vaccines, number one, they've got no basis behind it. There's no evidence to suggest that. And number two, you will see that their argument will just be flattened, because at the end of the day, lots and lots more people are now taking these vaccines. Now, don't be one of those individuals who are at the back end of this, so that you're putting yourself to, you know, in a situation where you are hesitant to that degree that you're, you know, it's time is taking its toll, and there's a greater chance of you being infected, and then there is that risk for some of the vulnerable people in your family. You got the opportunity, then take it. I'm getting patients knocking on my door now and saying, you know, Dr. Saab, when am I going to get my vaccine? You know, I thought you people are going to be giving us a vaccine soon. So we're saying, look, wait. The issue now is about we can't produce enough vaccines in time. You know, that's the issue now. It's not the problem of people not getting vaccinated, is that we're not producing enough for the demand that's out there at the moment. So yeah, you know, there's always two sides to every kind of discourse, really.
And I think that, I mean, you make some obviously really, really interesting, really, really valid points. I'd like to bring on some of the questions that, you know, that we've had in the comment section as well, to try and address some of those as well, inshallah, which is almost the flip side of obviously what you're talking about. But if I can bring in Iblal to talk also about the pharma industry, why we should be blindly following these people is what the question was. But if I can just ask very specifically for, you know, the vaccine, you know, whether it's you know, Pfizer or AstraZeneca or whatever it might have been, and the process that they went through, if you could comment on that as well, inshallah.
So, Jazakallah khair for Dr. Rafaqat. I essentially, me speaking about this trust in institutions, when we first initially drew up the plan for today's stream, the 4 areas that I highlighted were pharma companies, governments, public health, the NHS, or Muslim healthcare professionals. There is no one saying to you to blindly trust, you know, each one in its on its own. The fact is, these are all autonomous institutions that work together. They work together, and there are checks and balances in place. We have about 10 years ago, when we had the H1N1 pandemic, there was, you know, a mass hysteria about the actual severity of the H1N1 pandemic itself. And, you know, the EU actually came out and did an inquiry into the pharmaceutical companies and the way that they pressured the World Health Organization to declare a pandemic. So in and of itself, from that, you can kind of see that, you know, the checks and balances do work. Recently, last year, I think the London School of Economics came out with an article as well, talking about the lessons that were learned from the previous pandemic, and whether lessons were actually learned in this pandemic right now. So it's very interesting to see how people, you know, they zoom in onto certain aspects of mistrust in specific. Sorry, my eye keeps getting caught by the comments that are going by, but it's very reassuring to know that these checks and balances being in place is why we can kind of trust the system in its entirety, and not just blindly following BEMA or blindly following the public health institutions or the NHS or pharma companies. At the end of the day, the pharma companies, they answer to their shareholders. They're going to look for where the profit's at. But in this instance, you know, we're a year into this pandemic, countless lives have been lost. You know, there's no inquiry going on into whether this has been overblown, or, you know, whether pharma companies have leveraged their massive resources to try and, you know, sell their vaccines. Even in the Oxford AstraZeneca vaccine, there was a dosing mistake, you know, but that was found out because, you know, so much information was published to the Lancet peer-reviewed journal that people picked up on it. And again, rather than that necessarily being, you know, something that we should be worried about, we should actually be happy that people were able to scrutinize this data and bring it to the forefront of public attention. And then what happened is they resolved it by going to the independent bodies, which is the MHRA, discuss the issue that happened, and it was quite transparent. And that is essentially what we're looking at. It's a trust in the whole system in and of itself. And you have, you know, reputable epidemiologists, you know, panels of scholars and doctors that work in BIMA, for example. They are the experts. You know, Muslim healthcare professionals, your local GP isn't getting paid by the pharma companies. I can assure you that. They're not getting paid by pharma companies to inject that into your arm. There is no incentive for them. So, you know, there was a question that a brother put to me before I came on, you know, that doctors push the big pharma agenda. They, quite frankly, they don't. You know, nobody goes to study medicine for 5 years and, you know, works crazy hours in their residency to be working for big pharma. They do it because there is an inclination within them to help people. And they are using evidence-based medicine to figure out what is the best thing for you. Now, vaccines aren't necessarily an acute treatment. They are a preventative measure to treat a pandemic. And we will go on to speak about the safety of vaccines later on. But yeah, I think I'll leave it.
Thank you very much. So thank you. So I mean, I think the point where you both are obviously trying to make is that there are balances and checks that are in place, and it's not just the pharma companies. There's Public Health England. There's a number of other government organisations and agencies. If I can bring in Dr. Sufyan just to talk about the challenges locally as well.
Yeah. Bismillah. So actually on that point of trust, just very briefly, I spend a lot of my time with patients where patients have had bad experiences at the hands of their GP, for example, or at the hospital, that either themselves through misdiagnosis or family members where they've come to harm, whether that's through specific treatments or the process or allopathic medicine. And often what then happens is a very severe emotional reaction and a kind of a backing away from Western medicine, allopathic medicine as a whole. And for a lot of people, that's the area of departure to then losing trust, And what I'd say kind of on that point to anyone who out there who has been hurt or harmed is to kind of just realize and try and step away from that experience, as hurtful as it may have been, and realize that actually, this is something that, as we've heard, has been tested, has been scrutinized, and actually the benefits of taking something, a vaccine, though it may have come from a pharmaceutical company that you question for whatever reason, actually in this case, the benefits clearly outweigh any harms. And we've heard from Dr. Yassar, how disproportionately these things are affecting us. So Asim, in terms of your question, was there anything in particular that you were asking? I've forgotten it because I've gone on my own tangent.
That's fine. I suppose it was just the local situation as well. I mean, obviously, Dr. Rafaqat's saying that there's people knocking down on his door in the middle of the night asking for a shot in the arm. So I wondered if that was the same situation for yourself.
Yeah, definitely. There's shortages, and we're just hoping for more and more of the stock to arrive, so we can vaccinate more and more patients. There's people asking to be put on reserve lists. Alhamdulillah. And I think actually just on that point, we've started with the frailest of the frail. We started with the over 90s, with those in the care homes, those with dementia, you know, bedbound, housebound, and actually, alhamdulillah, we've all been fine. And that, you know, in the community that I've worked with, we've had no issues. Rather, the issues have come in the care homes where before we could get the vaccine out, we've had just a spate of deaths. You know, 12 deaths in a care home. That had this been a few weeks down, you know, that would have been a lot. You know, inshallah, we hope that would have been a lot more favourable and would have protected those vulnerable individuals. So yeah, so far so good, alhamdulillah. But a lot more work to do.
Okay, Bismillah. We're going to move on to the next question now. Do vaccines cause autism? I think there's obviously this challenge and this discussion that's been around for a number of years, I think. And again, for anyone who doesn't know the history, there was a GP a while back. Tony Blair was involved, and I think that was especially around MMR vaccine. I don't know if anyone on the panel is able to have a comment on that. Dr. Rafaqat, if you have any experience or knowledge on this area.
So basically what actually happened was, I can't remember the name of the actual individual, but generally speaking, there was a paper that was produced some time ago, and it was in relation to MMR vaccine. And this paper was such that it sort of indicated as a conclusion that there was a link between autism and in particular the MMR vaccine. So what actually happened was a lot of more research was done in this particular area. And there was some clear evidence, number one, first of all, that those figures were rigged. So this is something that actually happened, and there was a lot of work that actually went behind this to the detail of actually working out exactly how those figures were rigged. And this was exposed. And this was sort of brought to the forefront in journal articles and various other things after. And this particular individual was then exposed, his team was exposed, and then he sort of, as far as I know, I may be incorrect, but he actually then was taken away from the whole field of this research sort of area. Now, what actually then happened was a lot more research was done in this area to see if there is a link with autism and vaccines, and there is, you know, considerable evidence to suggest that that is not the case. And there are many articles you can pick up now. They're still available for those of you who have an interest in some of the academic sort of papers in this particular area. Now, that's not my particular area anyway, but generally speaking, I was looking at this because I remember that incident quite well, and at that time I was reading up on it, and we did look at a couple of papers with some of the epidemiologists that I know, and we saw that there was quite strong evidence to suggest that, you know, there is no actual link between autism and in particular MMR vaccines.
I think that the comment was Andrew Wakefield.
Yeah.
Bilal, do you have any comment on that?
I mean, generally, when children are born in this country, they get the MMR vaccine done. I know I had it. I don't know where this picked up from, but the thing is, there's so many different factors to consider here. There's you know, mountains of evidence to say that they don't cause autism, but it's really surprising. I think I read one comment here that said, are these vaccines safe in children? Well, I think one of the GPs here may be able to correct me. How many children get vaccinated with the MMR vaccine in the UK? I had it done. You know, the argument, I guess, is that the incidence of autism has increased over the years that, you know, the MMR vaccine was introduced. But correlation doesn't mean causation. You know, A doesn't always necessarily lead to B. But yeah, you know, there's massive amounts of evidence to say that there's not, and we have to go with the consensus.
Can I just add to that, because this is another area of interest, because yes, there is a much more increased number of diagnoses of autism, but it's not because of the cause. It's more so because of the fact that we've got better diagnostic tools. We're able to diagnose better. We're actually now fundamentally more focused around child development in terms of screening them at an earlier age. So those figures are a representation of effectiveness, not on the basis of, you know, there's a cause that's, you know, increased more. So I think it's as humans, it's only not natural human behavior to link A with B and C and come out with Z. So it's only human behavior to do that, and we use anecdotal approaches to do that. So I've been very closely linked with a family related to me where their child has autism, and they sort of, the only thing that they could see which was not natural, and this is how people see it, something not natural has occurred, an event has occurred which is not natural, and hence that must be the source. So people sometimes do like to explain things through external sources. So for that reason, the most obvious thing to them would be vaccines, and this is not that I'm saying that vaccines are always safe. There are clearly harms with vaccines, and there's evidence for that. But I think the system that we have in place that goes to the level of scrutiny that we do, and especially now we're looking at COVID in particular, that's what our discussion's about, that clearly there's more and more evidence to present and demonstrate the greater level of safety. We're getting more and more evidence that these are safe. Even now, hopefully what we're hoping is that even from the long-term perspective, number one, that we are protected by the vaccine, and number two, that safety profile is quite likely to be extended over a long considerable amount of time. And if a vaccine is going to affect you, it's going to affect you within the first few months, even within the first few weeks or even first few days. You don't need to wait for a whole year to decide whether a vaccine's had an adverse effect.
And I was going to say that's the next question, really. So the question that we have is, the vaccine is an experimental one. I think there are a number of different vaccines now, so and they're all experimental. So this, I'm just going to read the question. There's been no independent scientists who have peer reviewed this. You may well disagree. The EU and the UK have both lifted liabilities if an extreme side effect occurs. People can die from it? ? So why are Muslim scholars then brought out, and just Muslims generally? And if you look at the CDC statistics and realise that you're much more likely to drown than to catch COVID-19. I'm a complete layperson, and I'm sure that I'd be able to dismiss that last one. I think we've seen plenty of people catching COVID-19, and again, anecdotally, we've seen plenty of people passing away from a disease, and that's causing them to go into hospitals and ventilation and whatever else. So I think we can definitely dismiss that last comment about more likely to drown. But I think the side effect comment, and I think it was definitely one that was mentioned earlier as well, is that what are the long-term implications of the vaccines? Because we don't know. Dr. Rafaqat, you mentioned very likely the person is going to, they're going to have a shot in the arm, so they're going to have some localized pain and issue, where they were injected. They may well end up with a fever, nothing that's possibly unlikely to end up in hospital. But are there any challenges around, because the data's only been around for, 3 or 4 months? Do we know much past that information, or do we know much further than that? And again, that's a very valid, real concern that people have in terms of, I can get it now and I might be safe and okay against coronavirus and the effects of coronavirus, and my family may well also be safe. But in the long term, 6 to 8 months down the line, a year down the line, 2 years down the line, will it have an adverse effect on me and my family?
Okay, let's look at the question. This question is very misinformed. Let's start with the beginning. This vaccine is an experimental one. No, it's not. It's not an experimental one. We've had clinical trials where we've had over thousands of patients who volunteered and have had this vaccine. So we're not going through an experimental phase. It's already gone through a clinical trial process, and we've had a number of people who have been very clearly watched very carefully through the process. So that's a completely misinformation, whoever thinks that. That has no independent scientist to have peer reviewed it. Completely incorrect. There's been a lot of independent bodies. MHRA claims to be independent. You may dispute that. That's fine. It's got certain strong governance procedures that ensure that people are accountable on the basis of the decisions that are made. So and it's always open to scrutiny. MHRA is always going to be open to scrutiny. And let's say these bodies, these regulatory bodies, are accountable to the community, accountable to the public. So if they make any serious errors, you're looking at resignations. Not only that, but also there is that sort of sense of scrutiny that exists. Now, whether you accept it or not, that's a separate issue. But generally speaking, there are also independent people who are doing research as well. who are actually looking at the impact of vaccines. There are epidemiological studies, there are scientific studies going right down to the detail of the virus and its effects and its process and how it actually works and whether that is of any concern. So there are people who believe that it changes your DNA, alters your DNA, completely wrong information, misinformed. It doesn't affect your DNA. There's no evidence to suggest that, nor is it possible for it to do that because it doesn't even enter your nucleus. So there's just some basic medical sort of understandings of biological understanding you need to have to even understand that. Now, I get this a lot, in terms of people who come up to you and this ask you regarding certain masail, questions regarding fiqh and on many different issues. And then you sort of have to start off by saying, look, tell me, what do you know about this subject first? And that person will come to you and say, look, I know so much about it. And I said, look, learn Arabic, learn fiqh, learn usul al-fiqh, learn usul al-hadith, learn all these 10 different subjects, then come to me and then I can talk to you on the proper platform. Then we can really truly engage and we can have a proper discussion on the issue. Now, these individuals that come loaded with misinformation, and then they expect you to respond to that. So we'll respond to them because what's really important is the community is aware of these things. But a lot of this information, this question has been framed in a way that shows that this individual who has put this question together doesn't really have a deep understanding on the topic. They're either just taking people's views and making certain claims on the basis of that. Now, then people can die from it. Right, okay, so we've talked a bit about that. We've had 6 million vaccines given out, administered in the UK, more than that, and we've not had any deaths directly related to that. And believe me, if there were any deaths, it will be sensationalized all over the world. So why are Muslim scholars so brought out? Muslim scholars don't just sit there, they're putting themselves at line, their reputation at line. I'm putting my reputation, just coming here, talking about vaccines and not necessarily promoting. I don't want like to be thought of somebody. What I'm really concerned about, and I'll be very straight with you, if you don't want to have a vaccine, then that's fine. Go have a vaccine. That's your prerogative. We're living in a time of you can make your autonomous choices. That's entirely up to you. But please don't make a decision on misinformation. Don't make a decision on fake news. Don't make a decision on just emotive reasoning. Make a decision, on something which is informed, where you really truly know the facts clearly, and you are not being led astray in your decision-making process, and your reasoning. So as long as you are going through that process and then you're making a clear decision on the basis of that, you've balanced your harms and benefits, and you've come to a conclusion that alhamdulillah, you made your decision. That's fine, not a problem. But what we're finding is people are not making decisions on proper informed choices. What they're doing is they're relying on fake news, and they sort of making assumptions, and then as a basis of that, they're putting their elders at risk. So that's the problem. So remember that some of our elders, they can't make those decisions because they don't have the depth and the knowledge most of the time, or they may not be able to speak or understand English, for example. So they can't. So they're relying on you to make those decisions for them. So these are very important things. Then this says, look at the CDC statistics and realize that you are more likely to drown than to catch COVID-19. That is just complete ignorance to even make that statement. There's such serious lack of it. It doesn't even deserve an answer. The amount of COVID deaths that are out there. My father died from COVID, so you're insulting my understanding of the subject. Just on the basis of that. And people will be very offended from that statement. That okay, at the end of the day, people die from drowning. Okay, but surely you would put every cautionary measure to ensure people don't drown. Now, even if it's such small figures, even the outcome is so serious. The outcome is the loss of life. Even if the figures were really small, the outcome is the loss of life, and that is big enough for us to be overcautious. I don't know about you, but I would definitely be, and I'm very concerned about everybody. I'm concerned about my family. I'm concerned about the people around me. I'm concerned about my community, and I'm concerned about you. So now I will advise you, and I'll continue to advise you, because I've balanced my harms and my benefits, and I see my benefits are well overweighing the harms. So I have nothing to lose in this sense to take a vaccine, right? And I would just hope that you would get your figures and your sources right, so you might start thinking the same. So I mean, okay, let's say we're not presenting figures there. We're not having a long debate about the science behind it, because it's not something that majority of the people who are watching would understand. nor people will be interested in. What people are interested in is fast responses, straightforward answers, some element of emotion in, you know, how we present that, and that's what I'm giving you.
Just thinking about those sort of emotive questions that people have, Dr. Rafaqat, is the only way to try to counteract some of those by actually just giving the science behind it, and by giving, and not an equally, just the opposite, but just trying to come up with a logical, scientific approach to it.
Well, we're currently having a bit of a debate in a little group in Bradford about are we overdoing it with the science, you know? And because the thing is, the more information you give people, it's a mindset, really. It's a mindset, and if you are number one, if you're an anti-vaxxer, right, no matter what people say, you're not going to accept it. You're just going to use and twist it and bring it to your own, you know, to your own measure. If you're somebody who's just hesitant, which is quite legitimate, and that's fine, you know, that's not a problem at all. If you're hesitant about vaccine, then clearly you need to be talking to somebody who can give you the facts and give you the right information. Remember one thing, I mean, I normally do a presentation, and some of you I should recommend to watch some of those presentations. But you know, our Islam informs us a lot about these issues. And one of the first things it talks about is this issue of yaqeen and different levels of certainty that we can act on just in producing our fiqh, you know, on very mandatory issues. So on the basis of that, this isn't even considered as an act of worship. It's not an act of worship. Some people have even passed fatwa around the Middle East and saying that it's an obligation for you to take a vaccine. I don't believe in that. From my understanding, I think it's just optional. At the most, it's recommended. But on the basis of that, one thing that's really important for us to understand is that our Islamic tradition informs us that you don't even need to be certain about it. Yeah, it's good enough for you to even have what we call a madhnoon, you know, even some kind of contentment that, you know, above 50% chance that I would be right. That's sufficient enough for you to take something in this particular instance, which you know is being advised. You know, you don't have to be certain. So if you're looking for, you know, definitive proofs to tell you that things are, you know, permissible, you're very well mistaken. And there's a qaida in the Sharia which states that everything is halal until it's proven haram. You know, and this is not, we're not even talking about issues of impurity in vaccines, because there is no animal ingredients in these vaccines. So we're not even discussing that. We're talking about just the issues of benefits of harm, which is a scientific discussion. And on the basis of that, you can see that if clearly everybody's telling you that it's safe, you don't have to be certain about it. It's good enough just to be, you know, balanced on the basis of, you know, just 50% convinced that, yeah, fair enough, it's certain, with that possibility that it may be harmful. But I can see that the benefits outweigh the risk. So in other words, am I going to take this risk? Am I going to take this risk for my elders? That's the question you need to ask yourself. Are you willing to take the risk on the basis of something which is doubtful? And that's the thing here, because even if you do believe that these vaccines in the long term will cause you harm, and there's a very strong evidence coming out, that's very unlikely to happen. So I would say that it's reached a level of virtually what we consider as ghalabat al-dhann, which basically means that it's high enough for a level of what we consider as certainty. Yeah, but that could be questioned. So I'm not even going to push that agenda forward. But generally speaking, let's say even if you were madhnoon at that particular level, then it's good enough for you to take it. You don't have to, from even as a Sharia, refer to Islam on this discussion. It's just a personal preference. So on the basis of that, you need to make a decision personally about the elders and the vulnerable people in your family and say, are you willing to take that risk? Yeah, that's the question you need to ask yourself. Are you willing to take that risk on the basis of doubt? And that's what it is. If you think now, this late on in the period, that vaccine, the COVID-19 vaccine, is seriously harmful to you, right? I like to ask you, what kind of harm are you referring to? Death? Are you referring to serious disability? What kind of harm are you making reference to here? And at the same time, I also want to ask you that, are you going to decide and make, your conclusion on the basis of something which, from the Islamic perspective, lands on what we call shak, which is doubt. And doubt does not outweigh something which is madhnoon. which is of a higher level of certainty. So you can't bring an Islamic argument to oppose the idea of vaccinations. You don't have any basis in that, nor do you have any footage on this. What you can do is you can be skeptical about the vaccine, and you may make a claim that regardless of what everybody has said, I have come to the conclusion that vaccines are more harmful than they are beneficial, therefore I will not do this. Then I would question you on what basis you have made that decision. Who are you trusting to come to those conclusions? Because you are not capable of balancing the science to come to that conclusion. You're clearly relying on somebody to come to that and draw that particular conclusion. Can I just finish up with one more really, really important point? And this is probably more an issue of frustration for me. You probably can hear it tell by the tone of my voice. And that is that this whole discussion is being hijacked by those members of our community who have always lived with this agenda of us versus them. So it's always been a discourse about kuffar and the Muslims, and there's always an issue. So this idea, there's two components here which are really playing into this discourse, and they should not really be playing into this discourse. One is Islamophobia. Okay, so clearly we know that Islamophobia has really impacted our communities, and that's real. You know, it happens in different institutes, and that's a real thing. And even we may have a sense of distrust in our government for having an Islamic phobic agenda, especially with prevent very certain things. I'm not going to go into the politics, but clearly the main thing is a lot of our communities have a sense of mistrust in the government, okay, for those reasons. Now, this is a different kind of discourse. It's not the same discourse we're having here. This is about people's lives, and it's related to everyone. Everybody's equal here. The vaccine is not just for Muslims. The vaccine is for everyone. It's for non-Muslims. It's for everyone. So this is a much more wider discussion. It's not about Islamophobia doesn't necessarily come into this. Islamophobia does play a role in influencing people's decision making, but it doesn't come into a reasoned discourse on whether these vaccines should be accepted or not. The other thing is the fact that it's been hijacked by individuals and people who have always had this mindset about the kuffar and us. Yeah, there's that kind of discourse. So the kuffar cannot be trusted. Therefore, conclusion is, by reason, vaccines cannot be trusted. That's a faulty argument. It has no basis. And to be honest, if we start living our life like that, then you cannot trust anything. But yet these people that have that kind of mindset, they benefit from all the things that the kuffar produce for them. But yet when it comes to certain things that they pick and choose, they make a decision that is not acceptable on the basis of that. So it's a flawed argument. So we have to be very careful that this isn't being monopolized by individuals who have a different kind of political agenda. Unfortunately, it is. And this is the kind of thing that we need to avoid.
I think, I mean, I totally understand, and I totally agree, actually, as it happens with, with a lot of your arguments. And I actually wanted to say, I mean, if we have time, I would really like to draw on some of those comments that you made, because one of the last sections I had was that themes was to talk about misinformation, and definitely this us versus them narrative that we have, and again, I think we'd all agree that there are some places where we totally understand that there's challenges and issues around trust with government, but is this one of those? And is this, and I think again, if we could bring upon some of the, we can maybe possibly draw out some of those discussions in a bit, but if we can just focus on the vaccine and the challenges around the vaccine. I mean, one of the questions that we've got up on the screen at the moment is, again, it's a new vaccine, it's new to the market, especially when considering the MRNA variant of the vaccine available. It's a brand new technology. Has this been road tested? Again, I have my views, but if anyone is able to just discuss mRNA, again, you don't need to discuss, the science behind it or whatever else, but is it actually a new, is it a new medicine really, or has it been around for a while?
So very briefly, they've been using mRNA technology in vaccine research since 2011. So a cursory glance on the internet will show you that. But equally, I would say, and even to the question about, what are the long-term effects of this, because we've only had the trials for the last 12 months or less. I'd say this is not, vaccine technology is not new. We've been vaccinating programs internationally, globally for many, many years, many decades now. And so, I think, a lot of those niggles, doubts, etc., should be reassured by the fact that this is not new technology. This is stuff that we understand. And then the other thing that I echo what Sheikh Dr. Rafaqat said about the sort of harm benefit analysis. Certainly for me, that's enough. I mean, I get the flu vaccine every year. If I had the flu, chances are I'd probably be fine. But actually, my family, my patients, I need to think about. So, again, echoing what we heard earlier, younger patients are getting very bad forms of COVID. So it's obviously for yourself, think about the cost harm, but then equally for bringing that into your household, infecting others, etc. As a community, as a society, it's really important to weigh that really validly.
I think, Asim, if I may, there've been a couple of questions on the speed of the trials here. I think, like in this question itself, having is the time to market. I mean, if we look at the drug discovery process itself, it's massively resource intensive. It costs about $1 billion to get a drug from concept to market, right? If you think of a disease that you want to cure, right? What are you going to target? You have a whole drug discovery process where you try to find medications or try and create new molecules to actually target those specific molecules in the body. Whereas when this pandemic actually started, the Chinese, they actually sequenced the genome very rapidly. And what that allowed other people to do across the globe is to use that genome and then use that in their drug discovery process to try and find targets to attack or to mimic, so your own body can bring about an immune response to that specific target. So what usually happens in the drug discovery process is each stage, it happens linearly. So you have the drug discovery process where you do the research, what you want to target, etc., etc. Then you go on to the preclinical stage, then you go on to the clinical trial stage, then you go through the regulatory processes, and then you go through to manufacture. Because this is a massively expensive process, pharma companies do it linearly. So if there is ever a point where the drug is found as not safe or effective, then you haven't wasted a lot of resources. But in this instance, with this pandemic and the effects that it had globally, there was so much money thrown at it. Pharma companies were afforded, the flexibility to run these steps concurrently. So they were staggered. So you got the discovery process, which was faster than normal because the genome was sequenced really quickly. Then the preclinical stage and the clinical trials were staggered. And if we even look at the clinical trials itself, some people mentioned that the trials only involved 12 people. Well, that's just not true. I'm sorry. There were tens of thousands of people all across the world that were enrolled on this trial. And there are a lot of misconceptions about how clinical trials actually take place. I've seen some people saying things like, can you trust the people that are doing the clinical trials? Well, you have 150 sites worldwide, ethics boards, you've got clinicians, you've got teams, clinical trial teams. For there to be a conspiracy at that level is near enough impossible. So many different sites, so many different teams, so many different patients that this was tested on. And I think for the Pfizer, there were only 2 side effects that were notable, which was the fever at 2% and around about 2%, and headaches, again, around about 2%. So with that, we can kind of see why this was a lot quicker than what it usually would have been. It's just simple that the resources were there. Governments were willing to chuck as much money as they needed, at it because of the effects that the pandemic was having on the economy.
If we can have the next question, please. So one of the things about the COVID is that it can mutate, and it has, and there have been a number of variants now. So obviously one in England that was discovered, and another one from South Africa, I believe. So we know that the standard flu mutates, and it renders the flu vaccine quite ineffective. So generally, I think my understanding is every year it's about 60 odd %. So it's not, I mean, it's effective. I think you'd probably take your chances. But is the vaccine open to the same challenges regarding different strains, or is the genetic structure that the vaccine attacks quite standard across the strains? So if anyone's able to answer that, and again, I know there are probably different challenges around the different vaccines. So we've got the new Novavax virus, which apparently is a lot better at attacking the British variant. We're not so sure about the South African one, but again, Bilal, do you want to just take that one on as well, please? Just to start.
Yeah, I mean, the majority of these vaccines, what they do is they cause the body to develop an immune response against the spike protein. So on the virus itself, there are little cube-shaped structures on the outer edge of the virus. So what happens is your body develops antibodies that attach to those proteins and allows your white blood cells to essentially eat them up. So it depends. If there is a mutation in the coronavirus, that means that spike protein changes in a way that your antibodies can't attach to those proteins, then it may mean that we need a new vaccine. But so far, from my knowledge and my understanding, is that these new strains, there's not been any mutations in the actual target on the surface of the virus. Please do correct me if I'm wrong.
Does anyone else on the panel, Dr. Rafaqat, do you have a view on that?
Yeah, I think what you said is correct. So far, the evidence is suggesting that the current vaccines that we have currently at the moment, they are just as equally effective with these current new strains that we have. So the strain that we have in England, I'm not too sure about the South African one in terms of the more up-to-date details about that, but there is more and more knowledge about this area as time's going on. And clearly, we've got a lot of people who have been affected by these new strains. So they've got a good cohort of people to trial and test it on. So clearly, it's coming to that conclusion. That's the scientific evidence is pointed towards that at the moment. Yeah.
Thank you. So I'm going to move on to, I think hopefully that's answered people's questions, concerns that some people have raised regarding the actual vaccine itself. There's a couple of other themes that continue around the vaccine, actually, which I think are incredibly important from a Muslim point of view that we talk about and address. And again, I'd just like to echo what Dr. Rafaqat was saying earlier, actually, in that this is about information, about trying to get this is about trying to get the information out. Whether people choose to take the vaccine or not is, again, it's up to them. We do live in a country where people can make that decision and can make that choice. But the idea, again, for this evening, it really is that we are trying to provide some information, or as much information as possible. You may still feel like there are some concerns, but inshallah, it allows you to understand that there are people on the panel who are respected, who are truthful, who are knowledgeable about this particular area, and then hope, inshallah, that you take on board what they have to say with any other information that you have, and then you're able to make a decision based on that. One of the other things that I found incredibly important, actually, throughout this pandemic, and again, it's been over a year now, dealing with the virus by putting masks on, social distancing, etc., a number of other ways. Why has there been no information given in the mainstream media about building immunity? There are certain supplements that people can take. Are there any alternative medicines which people can use as well that may help produce a stronger immune response as well? And again, very early on, we know that there have been challenges with those who are who may have underlying health conditions, whether it's obesity, diabetes, whatever else, autoimmune issues, and then people will, started to look at, okay, let's see if we can try and fix some of those to help us. So are there any supplements that potentially could be helpful and useful to try to reduce the effect of coronavirus if you got it, or are there any supplements that one can take that will help build their immunity? Again, Dr. Sufyan, do you want to take that one to start, please?
Yeah, sorry, just on mute. Yeah, so there's more and more evidence about vitamin D, which is why a lot of people will be aware that there's been a recommendation, and even certain eligible at-risk people, so the people in the clinically extremely vulnerable list, can get access to free vitamin D. So if you don't know about that, I can provide a link or send a link out later. And you should top up on that. That's a recommendation anyway in the winter months, particularly for patients of BME sort of backgrounds, but all the more in light of COVID and sort of increasing understanding about immunity. In terms of how else to sort of fight the vaccine, well, that we're learning more about. The surgery that I work in, actually, we're currently doing a trial about inhaled steroids, so budesonide. And it's the principal trial that's being run by Oxford, and we're looking at whether that's beneficial or not. There's also the use of sort of other steroid type medication, like dexamethasone, for example, which is sometimes being recommended. Again, we're learning more about that. But in terms of using certain supplements to help, or I'm looking at the text of the question, or using alternative medicine, I'd say that any specific evidence is probably not there to my knowledge, and happy to be sort of corrected. But there's no doubt that people who are immunosuppressed, so have their immune system doesn't work for whatever reason, whether that's cancer of the blood or because they're on chemotherapy, etc., they're at more risk. So that kind of in a roundabout answers the question. That said, I know some of the themes may kind of, in terms of alternative medicine, and even there were questions about Islamic medicine that I've come across, might be a kind of a follow-up question that you're looking at. From
definitely, that's something that I'd want to again bring Dr. Rafaqat in on. But if I could just ask Dr. Yassar, I mean, you talk about being in the intensive care unit for a number, for a while now. Has the medicine that's been provided to patients changed? I mean, again, that knowledge base, has that been continuously improving?
Yeah, so I can comment on that, but just going back to the what we can do to prevent the severity of COVID symptoms. I'm sure there'll be research in due course about this, but just anecdotally, the people who do worse on intensive care, without a shadow of a doubt, are the obese. So if you've got obesity or hypertension, type 2 diabetic, the people who come into the ITU with that trio generally do very badly in terms of survival. Many of them die, maybe after a week or two of being intubated, ventilated. So I would say if we are going to be living with coronavirus for a long time, I'd say the number one thing is to lose weight. So diet-related changes, I would say, lose weight, and along with that, you'd essentially be treating diabetes and hypertension, and the prevalence of those diseases in our communities are relatively higher. So I think that's quite an important point to mention. In terms of the treatments that we give, they have changed. In the first wave, we were essentially giving supportive care. Essentially, all we do in hospital is give oxygen and treat with antibiotics for any superimposed secondary bacterial infections. And then essentially, we're giving time for the immune system of the patient to come in and fight the virus away. Along with that, we're giving support for blood pressure when people become septic and their blood pressure drops. And then also the things that have changed include we are giving increased doses of blood thinners, because we know COVID can severely cause sort of a lot of blood clots. So we're giving increased dosages of blood thinners. We are giving steroid cover as well. As soon as they enter hospital, we're giving a dose of dexamethasone, which is a type of steroid, for about 10 days. And we do have a number of studies as well. So occasionally we prescribed antiviral therapy and various immunosuppressant drugs. It's like interleukin-6 receptor antagonists. So there are a couple of drugs that we're giving, but essentially in hospital, we're providing supportive care, still essentially giving oxygen and just waiting for the body's immune system to fight back and defeat the virus. But yeah, I would just emphasize the importance of reducing BMI and treating those sort of lifestyle chronic illnesses, because the people with those sorts of illnesses generally do very badly in hospital with coronavirus.
Asim, I'm just reading one of the comments. Somebody mentioned a couple of medications, ivermectin, hydroxychloroquine, and colchicine as alternative treatments. With hydroxychloroquine, a study was done over at Oxford. Clinical trial was done. They found that there was no significant evidence to say that it improved outcomes in COVID patients. Ivermectin and colchicine, I've not seen any trials, not heard of any trials that have been done. But what I would like to really let people know is that when you yourself or anyone else goes into hospital, you know, the clinicians there, they use evidence-based practice to treat you. You know, they don't pick and choose, or if you were to ask to be treated with colchicine, if you were to go in with COVID, I'm pretty sure Dr. Yassar there, you know, correct me if I'm wrong, but would you provide them that colchicine?
No, I mean, you know, we go by the evidence-based medicine. You know, for the NHS, for all of its sort of faults in terms of long waiting times and whatever else, it has very robust governance processes, and it's very transparent. And as medics, as nurses, you know, we always have the patient's best interests at the center of what we do, and we don't discriminate, you know, based on age, gender, or any of these sorts of things, or ethnicity. And I know from having worked on ITU, there's a lot of work to do with regards to trust. So one of the common conversations I'm having with family members is convincing the family that it is in the patient's best interest to get intubated and put on the ventilator when they're struggling to breathe. There's a huge, in the first wave, it wasn't so much of a problem, but in the second wave now, you know, there's a lot of distrust, I would say, in terms of regarding being put on the ventilator and into an induced coma as sort of a death sentence. And there's a lot of work regarding trust to be done, I feel, within our communities.
I was just going to mention that one of the things is the we had a class this morning on the Minhaj al-Abidin, the belly and its protection, but it's also the spiritual protection of losing the weight and the fasting and everything else, which will also, inshallah, give us the physical strength to hopefully, if we do come across these issues, that we'll be able to deal with. Dr. Rafaqat, if I could ask that you could just pick up on that point about alternative medicine, and if I could ask admin to also pick up this next question as well, which is, as Muslims, we follow the Quran and we follow the Sunnah of the Prophet Muhammad sallallahu alaihi wasallam. So why in this day and age do we not use the medicine of the Prophet sallallahu alaihi wasallam? And why is this now a stance that this man-made synthetic medicines are the way forward and not natural herbal medicines? You know, we've had conversations that people have had about black seed oil or whatever else it might be, to have the ajwa dates in the morning and the evening, and that will be sufficient as a cure for us, or cupping is sufficient as a cure for us. And again, I understand that you have knowledge and practice in this area, and I wondered if you could expand on this a little bit, please.
Yeah, just before I answer your question, I think it's important just to reiterate these points that are being raised regarding vitamin D, colchicine, hydroxychloroquine, these other alternatives to vaccines. That why are we not investing time and energy and finance into these different sort of means? I think the really simple response to that is, number one, right, the issue related to vitamin D, and this is completely sensationalized, is that there's some evidence to suggest those people who are deficient in vitamin D have adverse outcomes when they are impacted by COVID-19. So that isn't to say that vitamin D, take excessive amounts and that'll protect you. It's not a treatment for COVID. It's just basically reducing your risks by taking enough vitamin D so you're not deficient. So this is issues of deficiency. So for that reason, it's encouraged that if you think you're deficient in vitamin D, then you should, you top up your vitamin D levels so that you're not falling within that risk parameter. So that's the issue there. It's been sensationalized to that degree, like vitamin D is the cure. Now, the other thing is, let's get back to the whole conversation about, colchicine, hydroxychloroquine. These are, drugs that are, we need to be very careful about, because these are drugs that we need to monitor. I'm reluctant to prescribe people colchicine in my practice because it causes an immense amount of side effects. They can cause diarrhea, they can cause abdominal upset, they can cause all these sort of adverse effects. If vaccines did that, we'd be throwing them out of the system. So why are we going for something which has a greater level of side effects and adverse effects? Hydroxychloroquine, you need to have regular blood tests done. You need to monitor your bloods to make sure you don't have certain deficiencies in your blood as a result of it. So these are monitored drugs, and you rather take them than take a vaccine, where vaccine is 95% effective, to some degree in some of the vaccines, but that really reaches a level of what we call ghalabatul dhann. That basically means that if you have haram ingredients in vaccines, like animal products, and the other option is to take hydroxychloroquine, even if hydroxychloroquine is really effective, it's not going to reach 95%. So even in that instance, you take those things that are effective. So it's, if the qaida, the equation is that if something is alternative, an alternative means, and it's not to the same level of effectiveness, then it's permissible for you to even take that drug that contains haram ingredients. That's the qaida. So on the basis of that, if you look at it from that perspective, we're talking about all these alternative means. Somebody's giving you the asbab are there, the means are there. Allah's giving you those means, and using our technology, our science that Allah has given us, we're able to produce vaccines that have alhamdulillah, such an effective outcome. So why are we looking at all these other alternatives and getting all frustrated about it? Why are people pushing the agenda with vaccines? And so they should push the agenda with vaccines. They're so effective, and they're very little, if any, side effects from them relative to some of these other drugs that people are talking about. So that's the first point. The second thing is regarding Islamic healing. Islamic healing is a very different sort of concept. Alternative therapy is, so if you're looking at issues such as hijama, cupping, and using black seed oil and various other means, take them. If you feel there is benefit in that for you, have yaqeen in them, take them. Our deen teaches us that these are things that are being made mention of by the Prophet ﷺ in clear ahadith, sound hadith. So if you have that sense of yaqeen and you want to take them, then take them. There's no harm in doing that. That's fine. Nobody's saying don't do that, but don't take those, don't ignore the other means which are clearly being demonstrated to be very, very effective, like vaccines. No, vaccines are protective. So why are we ignoring them at the cost of that? So for that reason, yes, go take, if you want to take alternative treatments, as long as they're not harming you, then alhamdulillah, that's not a problem. You go ahead and do them. But that isn't at the cost of those things that we know through clear evidence, okay, that they are effective. And why are we ignoring that? Now, the other thing that we also have to understand, and you made mention of this, the spiritual nature. What is our Islamic theology on this issue? Our Islamic theology is that we have different asbab, different means that Allah has given us to seek a cure, not just to the to the COVID-19, the whole calamity that we're in, the whole trial and tribulation, that this fitan that we're going through. Okay, and it clearly is a fitan for many people. It's affecting us not just only in terms of our health. So there's the issue of hifz al-nafs, i.e. our lives, but also hifz al-mal is affecting the preservation of our wealth, our financial institutes, and is even in fact affecting our hifz al-nasl, our family. The amount of stress through lockdown and various other things is impacting. I teach at an institute which works very closely and does a lot of sort of counseling, especially marriage counseling. We're getting lots of cases of issues arising in people's homes in terms of their marriages because of the financial strain, the strain on the lockdown and various other things. So there are many areas of things that need preserving. So on that basis, this whole thing needs to be looked at more the holistic sort of perspective. And from that point of view, if you want to take alternative measures and if you feel benefit in them, go ahead and do them. However, there are certain asbab, and the first sabab or the first asbab are what we call asbab batini or batiniya. These are those asbab, those means that Allah subhanahu wa ta'ala has provided us, which are in essence, and I was just reading a kitab related to the issue of the fawaid of mubtala, fawaid of tribulations and harms to the public. What are the benefits? There's a kitab written by Izzi Abdin Abdus Salam, okay, where he talks about, and this is a classical scholar, he talks about the benefits of calamities. And he lists approximately, I think it was like 15 benefits of calamities. And one of the main messages from those benefits are, this can be an azab for you. It can be a punishment for you, or it can be a rahmah from Allah for you. It can be a mercy. And how do we define whether it's a benefit or mercy? If you find that you are not having sabr, yeah, and having patience through this, and you are finding yourself, you're turning away from deen, you're turning away from Allah, then this is an azab for you. An azab doesn't come in the sense of, direct inflicted harm upon you, where you're feeling pain and injury. Azab is in the sense that you're devoid of the rahmah of Allah, of the mercy of Allah. So for this reason, this can be a mercy. You become closer to Allah, your family turns to Allah, you're reading more Quran in your home, you're turning to Allah, you're reading your salam more, you're reading more dua and azkar. The amount of times that people contact me, they're saying, Dr. Saab, give us a couple of dua that we can read, any wazifas that we can read, any wird that we can read. This is excellent, because people are becoming closer to Allah subhanahu wa ta'ala. Yeah, and inshallah, Muslims are always, they think of fa'al meaning they have that this is a good omen. We should always look at things in a positive way, and that has an impact on our whole psychology. It has an impact on our sense and understanding of our worldview. Now, that's a very, very important discussion that needs to be talked about, and I think there's very little of that. We're trying to do this with our organization, Al Balag Academy. We've put out a lot of courses related to this. However, the other thing is, Allah subhanahu wa ta'ala also takes us, so we talk about this, is tie your camel and have tawakkul in Allah. Now, at the current moment, I'm writing a chapter for a book that hopefully, inshallah, will be published. But in that, I talk a lot about the issues of asbab, the means. And in there, one area is the physical means. And these are the asbabul zahiriyah. These are the physical manifestation, how we take the physical asbab. So the Prophet ﷺ has indicated here. He said, number one, tie your camel up, and then have tawakkul in Allah. In other words, you must go and take out, go with all the physical means that you can have in place to avoid being infected with COVID, and then for it to have a detrimental effect on you and your family members. You have a role to protect your families. So on that basis, you must take up some kind of means to basically avoid harm to your family and yourself. So these are things that you should do. And these are the asbab zahiriyah. And at the same time, you must uptake the idea of asbab batiniya, which is to turn to Allah, repent, refrain from sins, and all these things. So gain a closeness to Allah subhanahu wa ta'ala. And Allah is Shafi. Allah is the one who cures. Allah is the primary cause. Allah is the one who has brought this into our dunya, and Allah is the one who will take it away. Allah is the one who will cure us. Allah is the one who will take our lives. And this is something which is a very important part of our theology. We must turn to Allah in such instances and such situations. And that is the true essence of a believer, that he has full faith in this and full conviction in this. But at the same time, the formula is that you take up the means to deal with the situation. Now, when Umar radiallahu anhu was asked, the Khalifa of Islam, when he was asked the question, why there is a plague in a certain area, why is it that you have decided to move away? Yeah. So the Umar radiallahu anhu said, and this, he was criticized for this. Why are you taking up these particular means? Why are you running away from something that's been destined? So the Umar radiallahu anhu's response was excellent. He responded by saying, I am moving from a decree of Allah to another qadr and decree of Allah subhanahu wa ta'ala. And that is through the taking of the means. So, to make such claims, I'm currently deliberately on this Telegram group. I'm not going to mention the name of this individual, but he's placing on there. It's such a frustration because he doesn't allow anybody to post anything on there. It's just his comments. So I'm really interested in that group. He's got some extreme ideas and interpretations that he's using statements from, and anybody who was on that group will know who I'm talking about. He's using statements from classical scholars, twisting them in his own understanding, which is a Shah's opinion. Shah's meaning it's an opinion that's rejected on the basis is of a minority. And he's using that, sensationalizing this, and trying to convince people there's no such thing as bad effects from bacteria and viruses. And he's using the Sharia to embody that argument. It's a failed argument, subhanAllah, completely failed argument. And it's a shame that we can't respond to it on this group, because it's only one-sided information he's sending. So people are being fooled by a lot of these things that this individual is doing. Right? So you see that many people are doing this on the basis of this. Make it very clear for you. You take up the asbabul batiniya, turn to Allah. That is the essence of what a believer does. If you want to follow Islam, this is the methodology. And then at the same time, you take the asbabul zahiriya, take up the means that is well informed, and use those means to basically protect yourself and your families.
Jazakallah khair. I think there's a couple of very quick questions that we're going to have. If we can just bring, so just in the comment section, there's been a couple of conversations around the vaccine payment scheme that the government have. So if people do have adverse reactions to vaccines, there's a payment of up to £120,000. Again, I think that some of the comments were there've only been 900 odd cases since 1978 to 2019, and if you, Bilal, do you want to comment on that one, please?
Yeah, I just saw it. 72, 74, whatever million, 120k payment. I mean, just take the argument to its logical conclusion. I think one of the sisters, Safina, has already done that. 70 million divided by 120k gives you about 500 cases over 50 years, compared to how many people that have been vaccinated. But yeah.
If we can just ask the next question. So, and I suppose this question is about what's your opinion of the doctors, the many doctors that have spoken out against the vaccine. They may have lost their jobs, they may have been blacklisted, and why would they speak out against the vaccine and risk losing so much if none of what they say is true? So again, a panel of health professionals, 4 doctors there. How many doctors do you know that have actually spoken out against the vaccine? And even if they did, what would they, they obviously have risked losing their livelihoods and their jobs. So Dr. Yassar, if you could answer this last question. I understand you have to go, but if you could, we could kindly ask you just to make a comment on that.
So I'm not aware personally of any doctor, not recommending you get the vaccine. Maybe they exist, but I've not come across any on ITU. I mean, maybe that's because I work on ITU, and I think I do have to go shortly, but I think the last thing I would say is I can understand the hesitancy behind vaccines, just as with any food, medicine, drug, or anything like that. But I think the reality is, if you look at the situation in hospitals, people who shouldn't be getting unwell. It's, as we've been saying all along, it's a balance of benefits and risks. And the risks are so severe, I wouldn't want anyone to end up in intensive care wishing they'd had the vaccine. And it's a very, very real thing. So that would be my last sort of point to make.
Jazakallah khair. Thank you so much for your time. Thank you for your efforts, inshallah, on the front line, as it were, and then may Allah protect you and your family, and continue to allow you to support us, inshallah. Jazakallah khair.
Jazakallah.
Thank you.
Wa alaikum salam. Stay safe.
Dr. Saf, can we, Dr. Sufyan, if you could answer that question, do you have again any knowledge, any opinion, any idea of doctors within your circles or people that you've heard about who've been very against the vaccine? I actually received a comment today, if I'm honest, from a doctor. I suppose a doctor. I don't actually know them personally, but they agree that there are some medical professionals out there who have reservations against a mass vaccine rollout without the sufficient knowledge of its long-term effect on the human body.
Yeah.
So there are,
so again,
people out there.
Yeah, so from a very personal perspective, I don't know of anyone personally, and that's in discussions that we've had with the whole GPs in Buckinghamshire, for example. everyone is keen to give the vaccine. But as with any opinion, there's always going to be people on the fringes of opinion. And the overwhelming majority, like I say, all of the clinicians that I work with in practical terms, and all of those that I look up to and respect and receive guidance from and follow that on a practical basis day to day, in how I practice medicine, are all for the vaccine. So that's kind of what I would say in response to that. Who do you want to listen to? That's what I would ask people, and essentially I can't choose who you trust, but I would just strongly recommend that you really look into kind of what their credentials are. If they're claiming an Islamic argument, is there, even if they're a scholar, are they the right type of scholar? And likewise, if in terms of scientific, medical, etc., make sure you're kind of verifying where that's coming from.
So, Asim, in that last little bit, so the comment itself was from a doctor you mentioned.
This comment is actually not from a doctor, but
okay.
She has she knows doctors, and actually put a doctor in touch with me who mentioned that.
Okay.
What I just read out there.
So yeah, just the last little bit. They said something about the long-term side effects.
Long-term effects, yeah.
Yeah, long-term effects. I mean, no medication comes to market with an understanding of their long-term side effects, right? There's 4 stages to a clinical trial. You've got phase 1, 2, 3, and 4. 3 is let's go straight to 3. 3 is the big one, where you'll have loads of different sites, thousands of patients that are recruited, and then the drug is trialed at the dose, and you see whether it's effective or not. When the drug is actually released to market, that's known as stage 4, and a drug will remain in stage 4 throughout the lifetime that it's licensed for a particular condition. So paracetamol today is still stage 4, right? And it's in this stage 4 of these clinical trials that we actually understand the long-term side effects of these medications. So with that, I would just say, this vaccine, it's not going to be rolled out. And what is a long-term side effect? What happens after 10 years? What happens after 20 years? Are we going to wait 10, 20 years before, we release drugs to market? It's not feasible.
Can I just respond to this as well?
Yes, please. Yes.
I think it's really important. Again, I'm talking from in terms of from the perspective. Okay, so these are Muslim scholars. Just like we have in medicine, we have many different specialities. We have those people who, they specialize in medicine. There's those people specialize in surgery. There's those individuals who specialize in more sort of subspecialities like hepatology, so mainly focused on the liver. Similarly, we have ulama who are the same. So in the whole sort of stream of ulama, you have those ulama who focus on hadith, those ulama who focus on fiqh, you have those ulama who focus on tafsir. And then you have subspecialities within, and these are specialist subjects within those ulama. So when it comes to fiqh, there are many areas of fiqh. So there are those ulama who focus more on issues of bioethics and medicine. Okay, so one of the frustrations that I'm finding that are people who are ulama, okay, and unfortunately, fortunately, there's not many of them, but there are certain ulama who are coming to the forefront. They have not a specialist interest in fiqh, for example, or they don't have a specialist interest in a subspeciality of fiqh, such as medicine or bioethics. And these individuals are coming to the forefront out of their frustration, being led to this understanding, and they've fallen into the trap of some of this fake news and so forth, and they are now for wherever reason pushing their agenda forward on this issue. Okay, if they've got a reasonable argument, then those arguments need to be presented forward, and we need to discuss those arguments, which is fair enough. Okay, now in a similar kind of way, you have the same kind of concept that exists amongst those people of the medical field. So in the medical field, you have those people who have a very good understanding of the way vaccines work, and they have the understanding of, in terms of some of these clinical trials, and they actually go more into the public health and epidemiological sort of perspective in this, and they have a good understanding of how to analyze data and so forth. Now, if you're going to talk to a typical GP on the street and expect This is like a typical GP on the street. Expect them to explain the the in-depth understanding of vaccines and how they are formed and made, and also the the biochemistry of how things in the processes. I'm afraid you're going to be a bit disappointed. That GP is not going to be able to address you directly with that. So let's be real about this point that's been made, which is a real important concern for this individual, and that is that there are certain doctors who are saying that they're hesitant about vaccines. I don't think any doctors standing out outright as a general physician who was saying outright that basically vaccines are completely harmful. Now, out of those individuals, you'll find that in America, for example, there are some doctors who have some element of vaccination hesitancy. So there's some evidence for this, and some of them actually completely they are at the moment hesitant to have vaccines. This is actually currently happening in America. I think things have settled a bit there now, but generally speaking, that was something which is quite real, and it was happening, and we need to be quite real about these things. But you have to also understand that virtually all those doctors, they don't have that depth of understanding and knowledge on that particular area. Now, you will have certain individuals within every particular speciality who have their own clear opinions, their own agendas, and various other things. Now, from our perspective, when we measure harm, we look at the things that are more probable, not those things that are doubtful. So we should go with the people who are experts within this area. We have to. We don't have a choice. When you turn to issues of, our deen, who do you turn to? You have to turn to ulama. Who else are you going to go to? You're going to start picking books up and interpreting your own way. You have to go to expert views. So that's an acceptable concept. So from that perspective, you have to go with who you feel that you trust. If you trust a very sort of rare number of individuals who don't necessarily have a subspecialist interest in this area, just a generic interest in that area. They've been doing a bit of research, and you're going to follow their opinion on the basis of this on an issue which is that serious. Then that's your choice. You decide to do that. You've made your opinion, you made your decision, but you should also face the consequences of your opinion as well and accept them. So, but most of us, we'd like to go with the majority opinion, where people we feel and we can have some sense of trust in them, in that this is probably the most sound of opinion. And we take risks in any kind of decision we make, even on the level of trust. We all take some element of risk in trusting people. So for that reason, we will go with whatever we wish. So yes, there are people who are either anti-vaxxers, or there are individuals who have some element of hesitancy, and even though they are small in number, believe me, they are very heavily sensationalized in social media. So if you are just one individual and you're very vocal about it, then you will be known all around the world within the space of a week. Whereas if you're completely supportive of vaccines, nobody will ever hear your voice. No one, anybody will know about you. So there is this element of how social media picks up on these elements. So if you make a decision, then please make it in a fair way and really reason it through. Balance your harms and your benefits, inshallah. Now, I'm going to have to go in a short while, so I'm just letting you know.
I literally had just one last question for you, and inshallah we'll we're coming up to 2 hours, and hopefully we've answered most of the questions that people have had. I suppose the last question from me really is about, there's a couple of questions about, what's the alternative view? Should we have, is there an alternative argument to this? And how much weight and how much importance do we put to this particular argument? And I think that it also asks part of another question that there is about this misinformation that we have is there's an argument that there's a claim that people been taken into intensive care units, they've been injected by doctors, and they're just left there to die. And this is an argument that has been made, and this is an argument a discussion that's been had. Is there enough for an alternative argument? Is there a need for an alternative argument in this case? In your view, Dr. Rafaqat?
I'm not really fully understanding your question. Maybe you need to explain it in a different way. What do you mean by alternative argument?
So you've obviously put forward an argument, and I think the panel have put forward an argument about people need to take the vaccine. It's important for them to take the vaccine to protect themselves and their families. And then you've obviously given your views on why people should do so. But it looks like that there's a number of people who believe that there is an alternative. There's an alternative view that needs to be considered, and it's not being given enough. And and there isn't a balance, as it were. that
Yeah.
needs to be discussed about this.
Okay.
And again, from an
Now,
Islamic point of view, is that how much weight do we give to these things? There is obviously there may be differing opinions from ulama on particular issues, but
okay.
does this come into that?
Okay, let me give you an Islamic response to that. And my Islamic
Please.
response to that is, let me give you a situation. Now, first of all, I think the root of this is how serious do you take COVID-19? I think this is the root of the conversation. If you're somebody who don't think it's serious and you think that it's sensationalized, it's trivialized, you're trivializing it, and you don't think it's and clearly there are people like that. They don't believe that we should go to the sort of the measures that we've gone through, and there probably is some argument for that. I'm not denying all arguments. There is probably some element of argument. Maybe you have gone to an extreme in certain circumstances, which is fair enough. Then there are individuals who basically make claims that COVID-19 deaths are not significant at all, and they trivialize that. Okay, so if you're of that school of thought, then I think I can't address you. I don't think I could say much to you. You just need to make your decision about anecdotal information that you're picking up from around you and make your decision on that. Now, let me just put that if you fear that COVID-19 is serious, okay, and clearly majority of the world feel that, to that degree that virtually every government in the world is doing something about it. Nobody's just sat there doing nothing. Then on that perspective, you're of that sort of frame of mind, that is serious and it needs to be dealt, depending on the level of intensity of stringency of measures that we use. Then the argument here is that even the fuqaha, they talk about even a situation where a person is actually in a situation where they are starving to death. Okay, so this is a state of ittirar, we call that. When a person is starving to death, in that situation, it's permissible for them to eat swine, to eat pig. Okay, and pig is completely haram. It's clear, sarih in the nas of the Quran. It's very clear that eating swine is haram. Now, in that situation, even if there is doubt of the benefit because you're in an immediate dire situation, yeah, and there are also reference made to drinking alcohol when you are choking on food. And all those physicians around us know that just because you're choking on food doesn't mean that drinking a gulp of alcohol is going to be a cure, okay, to the situation. Okay, there is some element of benefit by taking a large amount of alcohol. You may actually be able to get rid of the morsel of food that are stuck down your throat or whatever, or down your gullet. Okay, so there is some argument, but it's not really that effective. We know it's vision. But the fuqaha say because of the immediacy of need and the serious outcome, it would be permissible for you to even do that. Now, this is on the basis of things that are not even considered, especially with alcohol in this situation, as certain. Yeah, but yet we are allowed to take haram means to do it. Yeah. Now, that's why my point that I'm reiterating here is if you're looking for, I want certainty before I make a decision, then you're very wrong. Even in the Islamic Sharia, yeah, we recognize we're very realistic. Islamic Sharia, especially fiqh, is a very practical science. So it even claims and very clearly states that you don't need to reach the level of certainty. Without certainty is considered as a situation where you have very little doubt about something. And therefore, the ghalab is when you have very little doubt about something, and therefore you take up the means. Now, in this situation, what we're having is people they're having little doubts about certain things because there are very few people who are going to provide evidence for you on the contrary to a lot of the evidence. We're producing a lot of evidence to suggest the effectiveness of vaccines. We're producing a lot of evidence to tell us that, look, it's even this level of benefit. We're getting people who are the effectiveness is reaching 90 to 95% in these patients. Yeah, how much do you need? Yeah, our reality is, how much do you need? You're looking for 100%, you're not going to get it. You're looking for 100% in everything, you're not going to get it. So what you're doing is you need to make a balance of what you feel is the right balance for you. Okay, nobody's forcing it upon you. You make an informed decision. What we're doing is we appeal to you on the basis of reason, and that's what we're doing. And we are appealing to you on the basis of facts that are clear, and they're from the majority, they're peer-reviewed, they've gone through a process, they've gone through a system. You've decided possibly to go with those bits of information that are emotionally pushed as an agenda, they're sensationalized, and those are the things that you've decided to go for. And if that's your situation, then what can I say? However, there is a true element of vaccination hesitancy, and those people are quite genuine. They are bringing their argument forward, and that argument should be brought to the forefront, and people should look at that sort of argument and work through it. Nobody's saying that you don't have any recourse to this, and you should invite evidences that are out there that suggest the contrary. We're open to that, but at the present moment, we're not having any serious evidence out there to suggest that we should change this practice. Until that evidence is very clear, I'm not convinced, other people are not convinced. And that's the reality of the situation. The hujjah is upon you. Yeah, this is the stream, and it seems very legitimate at the moment, and all this evidence is suggesting that this is the route to take. If you have an issue with that, provide your evidence. Please don't bring sensationalized WhatsApp videos to me. I'm not interested in that. I want clear evidence, which clearly is peer-reviewed, it's gone through a process, and it's clearly suggesting that this particular means that we're taking is actually harmful. It's not good enough to say that there is a bit of harm. You have to say, you need to convince me that there is more harm in this process that we're going through, right, than there is in this alternative measure that you're saying. Okay, unless you can provide that, then I'm sorry, you can't convince. Yeah, so, and that is the call. If you decide to go on the Shah's call, what we say in the Sharia, the rare opinions, and you decide to attribute the whole of your argument on the basis of that, then unfortunately you make that decision. That's entirely up to you, and then you can go by that, inshallah. So hopefully that, it's a decision. At the end of the day, we all have to make a decision on this issue. We decide to go take our sources from wherever we decide, and we have to come to a conclusion, but not to any, this is not a small decision. Please don't underestimate the decision you are all making. This is a very serious decision you are making. It's costing lives. So please, be informed properly. If you finally decide at the end of the conversation that we've had, and the evidences we're providing you, that you don't want to have a vaccination because you don't feel like you want it, you got some kind of needle phobia, fair enough, that's entirely up to you. Okay, but please don't base it on false arguments. That's what you need to avoid.
Jazakallah khair. Thank you so much for your time, Dr. Rafaqat. You've been very unequivocal, I think, in your view. And again, Jazakallah khair, and thank you for your time across the country and a number of different platforms that you've shared with a number of different people and trying to bring this issue to the fore. And I think, inshallah, hopefully people will be a little bit more informed, whether they take the vaccine or not. Again, like you mentioned a number of times, it's up to them, it's their decision, but at least they will be more informed, and they will have a better understanding of the process and less sort of misinformation. And I know you said you had to go, so Jazakallah khair, thank you so much for your time.
Jazakallah.
We're just going to pick up on one last question. Wa alaikum salam wa rahmatullahi wa barakatuh. We're going to pick up on one last question from Amjad. Iblal, should we trust non-Muslim premature vaccines, instead wait for Muslims to produce a vaccine is better?
So
this is going to be the last question. If anyone else has any questions, feel free to answer. Feel free to message Karima, and if we can, we'll try to answer those at a later point.
So I think we spoke about this briefly before, the trusting non-Muslim bit right at the beginning of the talk. You can rewind and check that out there. Premature vaccine, I think we spoke about the speed of the trials as well, about halfway through, maybe 3/4 of the way. So please try and find that. Karima might release, clips of these specific questions later on if you don't want to sit through the whole thing. And the Moderna vaccine actually was produced by Turkish immigrants who were Muslims. But that is what I've got to say for that question.
I think, was it the Pfizer one that was produced by Muslims?
Was it the Moderna one or was it Pfizer?
It was the Pfizer one.
Ah, okay.
BioNTech.
There you go.
And then I think the only thing I'd add to that is do a survey of what vaccines the Muslim countries are using, and you may be holding your breath for when we have others, and there may well be others. But I've got colleagues So there's something called the Federation of Islamic Medical Associations across the globe. So they're Muslim. I went and did Umrah with medics a few years ago from around the world, and I'm in touch with my Turkish colleagues and friends, and they're actually using a Russian vaccine at the moment in Turkey. That bastion of maybe a bastion that some people see it as. But so yeah, and just realize actually there's a process here that's very Islamic in terms of how research is being transparent, how lots of people are commenting on it, how experts are kind of being sought and used to it. So I think that dichotomy that Dr. Rafaqat talked about earlier is a false one in a sense. And actually, there's lots of trusted people, regardless of their faith, but Muslims as well, in the process of these vaccinations, both in the rollout, both in testing, etc. There was a talk yesterday, actually, in Oxford online, where there were some Muslim epidemiologists who were talking about the vaccine as well. So you'll see that even though there aren't any strict sort of researchers, I'm not a researcher by means, but there are from across the board who have been talking about this as well.
Jazakallah khair. And just to mention the challenge about the Turkish using the Sputnik vaccine from Russia, I think Bahrain and the UAE are both using vaccines from China. So again, people can weigh up their options and what they want to do. Whether they want to wait for those ones if they ever become available in the UK, which I don't think they would. Okay, so Jazakallah khair, everyone. Thank you again for the last two standing in terms of quite a marathon effort. We hope that people, again, just to mention very, very clearly, very explicitly, the intention was to try and provide information for our local community so that people can make their own decisions, make their own mind up about what they want to do. Our understanding is that a number of people within the Wickham community and the Pakistani Muslim community have taken the vaccine. And again, that's up to people. You've had the information. Feel free to go back. There'll be timestamps. Whether you want to look back and look again at some of those, we'll try and link some of Dr. Rafaqat's other videos that will continue to provide information if you have still any concerns, queries, or uncertainties. But again, ultimately, this is a personal choice and personal to people. But personal people will then need to, we can pick up those consequences as and when they happen. Also, just a reminder, obviously with the continuing pandemic, we have certainly felt in High Wycombe the number of people within our communities who are passing away. There are regular ghusls and regular burials that are taking place now. So one of the almost side effects of that is the bereavement, is the handling loss, the way that the community have had to come together, or the way that the community would ordinarily come together and pay homage and respect to the family and those who've passed away. We've not been able to do that, and that's taken a lot away from our own community. So we have a session with Samina, who's a local counsellor and psychotherapist, about dealing with bereavement and loss. It will be next Saturday, 6th of February at 6 p.m. And I'm sure it will be really, really beneficial, and it'll be a really good opportunity again to speak to someone who is in a qualified, knowledgeable position and help us to understand our position when it comes to dealing with bereavement and loss. All that's left is to say Jazakallah khair. Thank you all so much for your time. Thank you for the comments. I hope we've answered those, and I hope we have provided the requisite or the necessary information that you need to make up your mind and your decisions. Jazakallah khair. Assalamu alaikum wa rahmatullahi wa barakatuhu.
Assalamu alaikum.
Alaikum salam.
مدى